Welcome back to a very special video on the cardiovascular system. In this video, we will be exploring the physics and mathematics around cardiac output. Some of you may love the sound of that, while others hate it, but these concepts are very important in understanding blood pressures around the body, as well as many cardiac diseases. Cardiac output can be defined as the volume of blood pumped out of each ventricle in 60 seconds, given by the equation cardiac output equals heart rate multiplied by stroke volume. A healthy resting adult heart rate is around 70 beats per minute, and stroke volume around 75 milliliters. Therefore, a healthy resting cardiac output can be approximated at 70 times 75, which equals 5,250 milliliters per minute, or 5.25 liters per minute. Although, since both heart rate and stroke volume can vary in healthy individuals, there is quite a large range in acceptable values for cardiac output, so these results should be interpreted within the context of individual patients. The equation for cardiac output can be rewritten as cardiac output equals blood pressure divided by peripheral resistance. An easy way to remember this is by using the physics formula V equals IR. If you rewrite the equation as blood pressure equals cardiac output times peripheral resistance. The unit used for cardiac output is milliliters per minute or liters per minute. Normally, an increase in heart rate is associated with an increase in cardiac output, which can be seen from the equation we just discussed. During exercise, increasing heart rate causes a larger increase in cardiac output because contractility is also increasing, meaning that in this situation, both stroke volume and heart rate increase at the same time. However, we can also see from this equation that if stroke volume decreases more than heart rate increases, the cardiac output will decrease. Therefore, venous return determines cardiac output, as the heart can only pump as much blood out as is returned to it in the first place. Stroke volume is the volume of blood pumped by each ventricle per beat. In a healthy individual, this will be around 75 milliliters, although it can double during exercise, which I'm sure you're all getting plenty of during lockdown. Stroke volume is dependent on the following factors: contractility, end diastolic volume, and peripheral resistance. Contractility is the force of contraction of the heart muscle. End diastolic volume is the volume of blood in the ventricles after diastole. Basically, this means that stroke volume increases when the ventricles' muscle fibers become more stretched. Peripheral resistance, also known as the afterload, is the resistance to blood flow away from the heart. It is altered by the dilation or constriction of blood vessels, but small changes in peripheral resistance rarely have a huge effect on cardiac output. The Starling mechanism is also known as Starling's law of the heart. It describes the mechanism of preload, which is important in helping the heart cope with widely varying venous return and balancing the outputs of the left and right ventricle. Essentially, stroke volume is proportional to diastolic filling, which helps with maintaining homeostasis in the body. In a healthy person, a decrease in stroke volume will cause an increase in end systolic volume, which will increase the end diastolic volume and ultimately increase the stroke volume. This also works the other way around. Thank you for watching. We hope you enjoyed our detour into biophysics today and that you found it useful and entertaining. Please like, subscribe, and comment if you want more similar content.